Good morning, everyone, and welcome to the third episode in WALGA's Public Health Planning webinar series for local governments. I'm delighted that we've got lots of returning people in our attendees, so it's lovely to see so many of you following the series along in the sequence. I'd like to just start by acknowledging that I am joining you today from the land of the Whadjuk people of the Noongar Nation, and I'd like to pay my respects to their elders past and present. I'd also like to acknowledge all Aboriginal people on the web joining us today, and acknowledge the traditional owners of the lands from which you join us as well. Today, we are shining a spotlight on data. This topic is enormous, and we could carve it up and frame it in multiple ways. But I was very inspired by a presentation I heard at the WACOS conference earlier this year about the Australian Child and Youth Wellbeing Atlas. And I thought there were so many synergies and ways that this could support local governments in their public health planning development phase that I've been working with Marketa Reeves from UWA's project team for a few months now to line this up. So I'm very, very excited to have this along. Just so that we can maximise everyone's speaking time, I'll just give a very brief introduction to our speakers for today. I'm very grateful to Tim Landrigan. I feel like we're friends now, Tim, after a first meeting in Northam last year. But Tim is the Acting Director of the Department of Health's Epidemiology Directorate. And Tim's team are the powerhouses and worker bees that have prepared all the health profiles for all 137 local governments in WA. Oh, I'm echoing. Is that my fault? Hang on. Pardon me, sorry. I'll just make sure that that seems to be okay now. Sorry, so Tim's team have been leading the development and producing and modelling all the data in the health profiles that have been provided to every local government to support them in the development of their public health plan. So Tim's going to talk today just a little bit about that data and how it can provide a foundation upon which you can build out the data story for your local community. And we also have Marketa Reeves, as I said, Project Manager for the Australian Child and Youth Wellbeing Atlas. This is a national project, but based, as you can see from her background, at the University of Western Australia. And I'm really excited to see a demonstration of the Atlas and how it can support you in your work. We absolutely always need a local government to show us how this work can be applied. So I'm very grateful to Karen Dales Anderson, who is the Childhood Development Planner. What a title. I love that, Karen. I wish I had that title. At the City of Wanneroo, which is really demonstrating sort of leadership and innovation in that space, I'd say as well. So Karen has been working with Marketa and the team at UWA to identify and utilise the data in the Child Atlas. Sorry, that's going to be a terrible shorthand for the Atlas to support some of the strategic planning work that the City of Wanneroo is doing. And a big shout out to other officers from the City of Wanneroo on the meeting today. I can see that there's a few of you, and hopefully this is helpful in joining up some of the work around the public health planning process as well. So We're going to start with Tim first, and then we'll move on to Marketa and then Karen to wrap up to show how this all comes together in practice. So Tim, I'll hand over to you.
Thank you very much, Chris. I'll just share my screen so that everybody can see my slides. Right. So as Chris mentioned, I'm currently Acting Director of the Epidemiology Directorate, and we've done a lot of the work to prepare the public health profiles for everybody. So I'd also just like to acknowledge the traditional owners. I'm on Wudja here in Perth, and I acknowledge the traditional owners of all the lands that people are on. I've got a picture of wildflowers there because we're in the season of Julba, and it's the time of the warmer weather and the wildflowers coming out. So just to start, a little bit about the Epidemiology Directorate. So I guess a lot of people are familiar with epidemiology following the COVID pandemic, but we study the analysis and distribution, the patterns and determinants of health and disease conditions in a defined population. So we look at the who, what and where of health conditions and disease. We monitor, assess and report on the health of the WA population, identify areas of need. We help to guide policy development and identify emerging issues and inform service planning. So that's how we became involved in the public health planning profiles. So we provide that baseline data for local governments to be able to work from. So we have three main areas. We do the epidemiological analysis, which I just mentioned. We also have a team that looks at spatial analysis and application development. And I'll talk a bit later about Public Health Atlas, which you can see there on the screen. And we also run the Health and Wellbeing surveillance system, which is monthly. We send out we ask for about 1,000 people each month from across WA, and we compile an annual report looking at the health and wellbeing of people. So at WA Health in epidemiology, we have access to a lot of data sets, and this helps form the foundation of our work. So we have the hospital morbidity data set, which is, it sounds worse than it actually is, but that's all the hospitalizations, all the inpatient data across all the hospitals in WA, both public and private. We also have information on the emergency department presentations. We have data set looking at mental health information. We have access to the cancer registry. I'm not sure if people are aware, but every cancer diagnosis has to be registered via the cancer registry. So we have all cancers diagnosed across the state. We also have information from the midwives notification system, notifiable infectious diseases. Similar to cancer, there's a range of infectious diseases that are notifiable and they have to be registered. We have access to the mortality data set, which is actually the cause of death, so we can find out what caused deaths for people across the system. As I mentioned, we have the health and wellbeing surveillance system, and we also work on the WA burden of disease, which is a summary measure of fatal and non-fatal outcomes, which we can use to compare the impact of different health conditions using a common currency. So the health and wellbeing surveillance system has been now running for about 20 years. So we've got 20 plus years of data, and on the screen you can just see some summary information from the 2023 collection. So we've got some information on the left there about adults, and on the right some information about children. And we now have a dedicated website available on the WA Health web pages, and on there you can get historic data. So we have a trend dashboard that we've recently produced, which now has all the information going back 20 years, and it also now has information by health region, which we've only just recently have published. So that is available, and I think the link's included in the slides, which I'll send to Chris. So for the health profiles, we had a look at all these data sets that we had, and we came up with this list of information that we thought would help local governments with their public health planning. So we provide a bit of a demographic overview, which we get the data from the ABS. So that has some population information, as well as information about low income people, the number of Aboriginal people living in your local government, and various other demographic information. From the health and wellbeing survey, we have a few items there. So we have some nutrition information, whether people eat their 5 fruit and 2 veg, 2 fruit and 5 veg, sorry. Some physical activity, overweight and obesity information, and some mental health conditions. We also try to look at the risk factor, for example, in this case, tobacco use, and then the outcomes. So we have information on tobacco use from the survey, then we have number of hospitalizations due to tobacco, and then the number of deaths due to tobacco. And similarly for illicit drug use and alcohol-related harm, so we have consumption data, hospitalization information, and then the deaths caused by alcohol. We have some injury-related information, which injury matters very like us to include, and we have some notifiable infectious disease information. So this is what the profiles look like. I'm sure many of you have probably already seen these, and we've put these together as a PDF, and we have some information as well, some interpretive information to help you understand what the data is showing. So, slides not moving. So just quickly a bit of information about the survey. So a survey is the data for HWSS is taken from a survey. So the numbers we present are estimates. So we never know the true number of people who are overweight or who smoke or drink alcohol. But we get a good estimate, and we weight the data for age, sex, country of birth, marital status, employment, a few other things, so that we get a true representation of the whole WA population. We report data for the whole of state and the health region annually in our physical annual report, and we'll now start updating the Power BI dashboard every year once that data has been produced. So the team are now currently working on the 2024 data. So there are some limitations around data, of course, because as I mentioned, especially for the survey, it's estimated data. And even with the administrative data, there is some limitations, especially timing and lag. So at the moment, we're currently looking at 2024 data for the administrative data, and that should be available soon. We're just waiting on some coding information in there. For death data, it takes even longer because it has to go through the Register of Births, Deaths and Marriages, and then gets compiled by the ABS. So that's usually about a 2-year lag for that data. For the hospitalisation data, we only have patients in the WA hospital system, so that's both public and private. At this stage, we don't have data from GPs or other local clinics. We are looking at how we can access that data, but we don't have that currently. So there are some conditions where people may go to the GP rather than to the hospital, which we're not capturing. And we still have limited data available for children aged 0 to 15. But for the health survey, we've just launched a pilot where we're looking at how we can increase those numbers for the survey and try and get more children on the survey information, and so we can provide more information. As many of you know, some of the local governments are very small and have very small populations, and we've previously had trouble providing information for them. At one stage, we were only able to provide data for 43 of the 130, well, 139 if you count Christmas and Cocos, but 137 local governments. So to produce small area estimates for those other LGAs, we've started using a Bayesian modelling approach. And this allows us to provide smooth, robust estimates of health indicators for the small areas. So what this does, it looks at the previous 10 years of data. So if we're looking at local government 2 there in the blue, we look at the previous 10 years of data for that, as well as the previous 10 years of data for the neighbouring LGAs in orange there, so 1, 3 and 5. And we use all this information, including age, sex, and other information about the people living there, and we fill in those gaps. So this means now we can provide annual data for the reports and the profiles, instead of having to previously combine 5 or 10 years, which gives everybody a bit more information to help with the planning. So we also have, as I mentioned, so we have put all this data on the Public Health Atlas, and that has a lot more information for local governments than what's in the current profiles. At this stage, it's only available for people working inside the health system, so talk to your health service providers to see how they can assist you. We are working on a publicly available version of the Atlas, which we have been talking with data custodians and the Aboriginal data governance team on how we can make that publicly available. And as part of that process, we're also updating the data in the Atlas. So the modelling process used to take us, for some indicators, it used to take us 2 weeks, having a supercomputer sitting on one of the desks out here, running for 2 weeks, modelling the data. But we've recently streamlined that process, and what used to take 2 weeks now can take a couple of minutes or an hour. And so that has helped us really improve our processes. And we're also streamlining the process to create the profiles so that we're working on updating all of them from 2020 data to 2024. So as you can see on the picture of the Public Health Atlas there, this is tobacco smoking across the state. We've filled in all those gaps that you can see. So every LGA has data now. It only goes up to 2020, but we are working, hopefully by March next year, we'll have that all updated for 2024, and we'll have a publicly available Atlas for everybody to access. Finally, I just want to mention some of the other public health planning resources that are available on the Department of Health website with the links there. So we've got a few fact sheets. We've got guides to public health planning. We've got the fact sheets focusing on Aboriginal health and climate change. We also have some resources that provide an overview of links to other websites that may assist local governments in their public health planning, and some alternative data sources. And we also have information about grant and funding opportunities from Healthway and Lottery West. So I recommend everybody, if you haven't already, have a look at those 2 web links there on that page. So I'll finish up there. There's some contact information on this slide. As I said, I'll provide all this to Chris and she can distribute it to everyone. So thank you for your time.
Thank you so much, Tim. And I think you've captured beautifully what your role is, and the directorate's role is to share data that you are the custodian of. So by no means, is the Department of Health saying this is the be all and end all, and this is the only data you should be looking at in your local public health planning process, but it's sharing the data that they have available and are able to produce, but in a value-added way. So it's modelled, you've accommodated for any risk around data for very small populations. So you've done a fabulous job, Tim, and I think it's a great service that you've provided to local governments to support them in this way. It's really useful. It's really useful as well to hear about all the varying variable processes that various data items have to go through, such as deaths, in order for their public release, because I think sometimes, and I've been guilty of this, I open data and it looks old and dated and I sigh and think, well, what am I meant to learn from this? And it's very easy to be critical, but data analysis and release and managing all the privacy and statutory constraints around data is super complex, and I just want to applaud you for really being able to find a way to provide as much data in an accessible way as possible to local governments, but also turning up and explaining the logic around it as well.
Thanks,
just a reminder that your health service provider, so if you're in a country local government, your WA Country Health Services regional health promotion team will be able to not only distribute your health profiles if you haven't accessed it already, and equally the East, South and North Metropolitan Health Services health promotion teams have your health profile if you haven't already accessed it, but they are also the conduit to the WA Health's Public Health Atlas. So whilst it's not publicly available, they can sit down with you and look through the Atlas for particular data sets that you might be particularly interested in. So if your health profile sparked an interest in a particular cohort of your local community and risk factors around that, ask your health service provider if they've got additional information that can build that story out for you. They can also assist you to interpret that profile. So if you open the page and look at the graphs and the wriggly lines and, like me, get a little bit like brain shut down, I can't deal with this, contact your health service provider. They can sit down with you and help you interpret what those lines mean, and then how you can apply them in your health planning process and translate them to your various teams across your organisation. So don't feel like it's set and forget for the Department of Health. They've got all these teams and resources standing ready to support you to utilise that data. As Tim mentioned, the one of the limitations in the health profile is around the extent of data for children. Is it 18 years or 16 years, Tim?
Yeah, up to 16 years.
Up to 16 years. And that's why I just thought strategically it would be great to explore a platform. And this is one platform. There are others as well. But I think this atlas actually captures those other data sets quite beautifully. But the Australian Child and Youth Wellbeing Atlas sort of is a way of filling in some of those gaps and addressing some of those limitations. So I'll hand over now to Marketa, who's going to take us through that resource. Sorry, we can't hear you.
Can you hear me now?
Yes, that's beautiful.
Yes.
Thank you.
Is it loud enough for everybody if I put this here?
Yeah.
Yes. Okay. Because that's probably the closest I can get it without my desk falling over. Here we go. Fantastic. Well, thank you, Chris. Thank you, Tim. Thank you for giving me the opportunity to present today. It is an absolute pleasure, and good morning to everybody here on the call. I have some slides to share, but before I do that, I would also like to pay my deepest respects to the Whadjuk people of the Noongar Nation, the traditional custodians of the land from which I'm speaking here today, and my special regards go to all their children and young people, and therefore the futures of the leaders of our future and tomorrow. Look, I will start. While we're waiting for the slides to be prepared, here we go. Can everybody see this? Right, thank you. So look, I'm here to present to you and speak about the Australian Child and Youth Wellbeing Atlas. The Atlas has been live for close to 2 years now. We launched in November 2023. Prior to the National Atlas, there was a WA predecessor of the Atlas called the Child Development Atlas. Some of you might have heard about that version. That was live for about 3 years before we developed into the National Atlas as it is. Now, because I've been given quite a bit of time by Chris to speak today, I thought I'll give you all a bit of an agenda so you don't feel like, oh my God, what's this woman going to talk about for the next 40 minutes? So there's a bit of an agenda. We can take that quite fluidly, but really I'd like to talk to you about what the Atlas is, a little bit about the background and our aims. Then I'd like to explain to you what is in the Atlas, because it is a holistic resource. So we look at wellbeing holistically, and there are lots and lots of different things that impact our wellbeing. So I'd like to explain a little bit about the framework and the categories that we use to structure the data. Then we'll go into a demonstration. I'll sort of explain basics of the Atlas and how it works and how you can navigate it. And then we'll go back to the slides and have a bit of a look around how communities can actually use the Atlas. How is this helpful? How is this helpful to people who perhaps don't work with data every day? And I've got some examples for you from communities who've used the resource. And then I'll try and link it in with, how can this support the state public health plan, and especially you, the community representatives, as you're working through the plan and looking at your priorities. So we'll attempt a bit of a policy alignment, and then I'll close off with the data snapshot and what we call data mapping, which can help you do a data map for a community that is broader than, I will just say now, for example, health data that has a lot more contextual information. And after that, I'll hand over to Karen, and hopefully I've done a bit of a segue, Karen, for you. I've looked at some data for Wanneroo. So we'll use the LGA and statistical area of Wanneroo to sort of do a bit of data mapping, drill into some of those priority areas. I've picked youth mental health. I've picked the Australian Early Development Index, because I'm sure Karen will reflect on that. And then we'll go into some material wellbeing, material basics data as well. And then from there, if there's time, we can do a bit of a Q&A. But let's just get straight into it. So firstly, the Australian Child and Youth Wellbeing Atlas, and it's absolutely fine. We can call it the Child Atlas, the Child Wellbeing Atlas, Child and Youth Atlas. But what is important is that we cover data on children and young people from 0 to 24. So not just 0 to 17, so we go all the way through to 24. Absolutely critical to look at that age bracket. We feel that typically when we look at data, often it is across the population, and children and young people are often lumped in with an older age group, and it just doesn't allow us to get a clear picture and a better understanding of how children are actually faring. And without this information, we're not able to make, really significant impacts, because we all now understand how important the early years are, how important early prevention is. And so by not having a clear picture of what goes on for children, we're really robbing ourselves of the best opportunities to set our communities up for healthier futures. A key thing about the data asset is that it's free. It's public, it's free. You can just jump in. You don't have to sign up. There's no license. You can go in, you can start browsing and just get a bit of a feel about what is in the atlas. It is holistic. So like I said, we look at wellbeing through a holistic lens. I've got a bit of information about what that means. And we're very big on promoting equitable accessibility. We understand that some communities engage private research agencies and consultants to do community planning for them, and that is all perfectly fine. And as Chris mentioned, there are lots of different resources you can use to help you build a data picture of your community, but it's not equitable. If not everybody can access it, it is not equitable. Not everybody has access to the same information. And so therefore what drives us is to provide a resource that everybody can access, and that that therefore has to be free. What we want to enable is access to data, and we hear this from all our stakeholders, and this is not just community representatives, it is academics and researchers, it's policy professionals, clinicians, it's young people themselves, families, people who work with, for and on behalf of children and young people and their families. They want to have access to data to better understand how children are faring. We're visualising the information. We understand that not everybody is a master at spreadsheets. A lot of people love them. I do, but it doesn't work for everybody and often doesn't tell the story very well. So we visualise the data in ways that we're hoping unlocks it for many more people than it otherwise would. We allow analysis, so you can download data in your standard Excel and CSV files so you can analyse the data, and we allow monitoring. So by providing data over multiple years, we allow monitoring of outcomes over a longer period. I've got here on this one, and I'll do a full demonstration, but just so you've got a bit of a picture in your head as I'll go on to explain the, sort of what's behind it. So basically the atlas is what you get as a map of Australia up here in the top, and you can choose a region or you can scroll into it and zoom into it. You get a couple of filters here on the right-hand side with all the different topics, and then you can highlight an area. You have the topic here, and then you get results. That's basically how it works. The basic map settings are pretty easy to get your head around. I'm sure once you've done it a couple of times, you'll go, okay, that's not that hard. And then once you've selected a region, you can zoom in and you get your results panel here. And as you can see, we work a lot with colours. That's the whole idea behind geospatial mapping. We work with colours to give contrast to scores and results across different areas. So that's kind of what the maps look like. But before we go into a more in-depth demonstration, I'd just like to explain the need for this. So why would a group of researchers from UWA go and, put together a resource such as this? So behind the platform is Professor Rebecca Glauert, who has over 15 years worked with administrative data sets and linked data to look at health outcomes across the lifespan, but particularly for children and young people, and also looking at social determinants of health. And the realisation across the group has been that the data on children and young people are typically held in a multitude of disparate locations. So individual government departments hold data, different research organisations hold data. And if you want to get a comprehensive picture of how children are actually faring, it is really time consuming. It's resource intensive, costs money. You need to have people with the right skills. It requires a lot of data sharing agreements. It is a difficult journey to get to that comprehensive picture of children's wellbeing. And what happens as a result is that we don't have the opportunity to make truly evidence-based decisions because we don't have all the data that is available, or at least should be available. And so that's the drivers behind us. So we just want to be able to see how children are faring across the whole spectrum of wellbeing. And we want this to be not too complicated and not take 3 years for people to sort of get through and be able to build that picture. We know that policymakers, researchers, service providers, community members themselves require this access. So they make a strong, they can make a strong case about how children and young people in their community are faring and what perhaps is needed to improve outcomes. We also understand that children and the community that they live in is important. So a child lives in their community, and the community that they live in has a really strong impact on their outcomes as well. So it is important to consider the community as a whole and as much information as we can gather. So the Atlas presents a unified source where people can access this information, and in a way that makes it much less cost intensive and faster, and allows that comprehensive overview. A couple of words about the partnership. In case you're wondering, it's a national project. How is this possible? How can we pull this together? So behind the project is a huge partnership of over 30 partners. The partners are academic partners and research partners, government partners, of course, as well as not-for-profit and philanthropy. We're currently funded, and a big thank you to the Minderoo Foundation and the Ian Potter Foundation, who are funding the Atlas at the moment. Prior to this, the prototype was funded by the Australian Research Data Commons. So just to mention that, of course, building a national resource, being able to link in with all these different data custodians and data collections requires a joint effort, and we like to refer to us as the coalition of the willing, but I have heard this term been used quite frequently lately, so I've become a bit cautious in using it. Let's look at how we structure the information. So when you first come to the Atlas, and if maybe children's wellbeing or children's health and wellbeing outcomes is not your core policy area, you might be overwhelmed by the information that you'll find in the Atlas. So for those of you who are not familiar with the NEST is an evidence-based model developed by the Australian Research Alliance for Children and Youth, abbreviated to ARACE. And they have published this model. It's over 10 years ago now, and it's become, I would say, Australia's most recognised child wellbeing framework. And the framework identifies 6 wellbeing domains. So 6 key domains, we call them themes in the Atlas, 6 domains that impact wellbeing. And it's not just for children, really. If you look at the titles down here, you'll understand all these things impact adults' wellbeing as well. But they are the 6 wellbeing domains for children. A 7th domain around sustainable environments may be included in future. We have already added it in the Atlas. So we have a 7th theme, which is environment, looks at air quality, temperatures, climates, indicators and such. So we can go into that a little bit later as well. But I'll just quickly speak about those 6 indicators of wellbeing so you understand a little bit better what's behind them. And I will actually use the original framework, which is what Eraser have on their website. If you're interested to understand it a bit more so that you actually know where the data comes from, I've put the URL down here. But so the 6 wellbeing domains are healthy. So we want to promote good physical and mental health in children. We want children to be learning, so encouraging effective learning and development opportunities from early childhood through to adult life. We want children and young people to be participating. So we want to engage children and young people in decision making and especially in processes that affect them. We also want to ensure that they have the material basics that they need. So providing access to essential material, needs such as food, housing, transport, and other essentials. And we need to ensure that children are valued, loved, and safe. So ensuring children feel valued and they grow up in loving and secure environments is absolutely critical. Lastly, we have identity and culture. So we want to be supporting, as a society, supporting a strong sense of self and belonging. And this includes cultural identity and values. And then the 7th domain will be the environment. This little graph just shows you that when you're in the atlas, the indicators and data that we have are not evenly distributed across all these 6 or 7 wellbeing domains. By far, the most amount of data you will find under healthy. We've got a data wheel where we can see, each of the indicators under each domain, and the indicators under healthy represents close to 70% of what's in the atlas now. Then there is material basics and learning. The 2 domains that have the least amount of data is participating and identity and culture. And this is not because we don't think they are as equally important as the others, but because information around these and the important indicators are often difficult to come by. So we're not very good in sort of asking children about, say, their sense of belonging in their community. We don't have a standard survey or sort of robust national data collection that would tell us about how strong children's sense of belonging is in their community, how well they feel at school, how they're getting along with their friends, how safe they feel in their community, or how the relationships are with their family and their caregivers. So those things we don't capture in the same way as we capture hospital admissions, for example. So therefore, often there are data gaps. And we may need to look to other collections to sort of get a better understanding of outcomes in those areas. I've seen Tim before. He showed some of the data from the health and wellbeing surveillance system where some of these questions are asked. But as he mentioned, the sample size is relatively small. And so then if we look at a more granular, with a more granular lens at smaller communities, it is difficult to really understand how children in a particular community feel about those things. So there are some clear data gaps where we, as an organisation, we're advocating for better data, but we just also need to understand that, there are some gaps that we just won't be able to fill for now. A note on privacy, in case you're wondering, there is no individual data displayed. It's a publicly accessible resource, so no individual data are displayed or can be accessed by users. The data is visualised to agreed levels of aggregation. So we have arrangements with each of the data custodians that we source data from, and we agree with them if we aggregate to suburb level, which is typically, it's called statistical area 2. If you're not sure what that is, we have on our website an explanation about all the different statistical areas. But it's typically a suburb level. In regional areas, it's a bigger area. And then SA3s and local government area. Actually, one good analogy that I sometimes use is if you imagine Australia like a puzzle, and if you had that puzzle in front of you and it's got 2,500 pieces, then each one of those pieces, roughly, would be an SA2. That's kind of what an SA2 is. But at the same time, the puzzle pieces aren't the same size. In urban areas, your puzzle piece would be really small, so typically that's suburb. And as you get to bigger regional areas, the puzzle pieces get bigger. We also have to suppress low count, so that's to avoid no individual data or to have no risk of re-identification. So we suppress low counts and data for very small populations. We also follow the 5 saves. I won't go into them here. That is a bit more technical, but if you have questions about this, I'm very happy to answer that offline. Well, let's go in. I'll start demonstrating the atlas so you actually see. And if I do this, can everybody see the main website now? Yes? Great. So this is our main website. It is about to change, actually. I should mention this at that point. We have been live for close to 2 years, and we will be launching the 2nd generation of the Atlas next month. So the website and, most importantly, the maps and the functionality in the maps will change significantly.
Sorry, Marketa. Sorry,
yes.
Marketa, we're just still on your slides.
Ah, yes, that happened. Okay, hang on. So what I need to do is, because I'm in this slide view, hang on. If I do, I'll finish this slideshow. Stop sharing.
You might just need to cross over and share the web.
Go online, and then I'll do this. And I'll bring this across here. This should work for everybody.
Yeah, that looks good.
The main website. Yeah, so as I said, so this is about to change. Main navigation will be the same, but we're most importantly, adding functionality to the Atlas and a lot of new utility as well. But with the website, you sort of go in. What you have at the top is a little bit of information about the Atlas and the team and all those things. Really important are those indicators. So as I've just briefly presented the NEST domains, the 6 wellbeing domains, they are all listed here as well. And you can click on any of those. And see how we've got all the individual indicators there. So if you find an indicator in the Atlas and you're not sure what it is, what it means, where it's come from, if it's relevant, you can go into the indicators overview, open it up. It shows you which indicators are underneath this one. It gives you some policy context and references for further reading. So that gives you some policy context and pointers as to why these indicators are important when we look at wellbeing of children and young people. We have technical information, the statistical areas, the puzzle that I just explained. We have a technical explanation of that here. Also metadata, the methods we use, and technical information. And then there are some user guides. So if you're recommending the resource to somebody and they've not seen it before, it might be helpful for them to jump on here. We have a short video that explains, how to sort of do the first steps and navigate the Atlas. You can also download the user guide here. When you first come into the Atlas, this is what opens up first. It jumps straight into number of births. And there are a number of ways how you can change what you're looking at. So here, I could just into my theme box, I could type in any topic of interest. So for example, I can start with hospital, see how straight away you'll get any drop down. So total admissions at public hospitals, ED presentations, hospital admissions due to injury, and so on and so forth. So if you just want to see if a particular topic is in the Atlas, you can go into the themes search box. If you understand a little bit about what to expect under the NEST, you could drop down into the themes and see here are those 6/7 NEST domains. So here's healthy again, identity and culture, learning. So if I click on healthy, the subdomains open up. And then I can scroll through and see what's there. And for example, I'm interested in mental health, so I click on this. And then I can go down and here I can see ED presentations due to mental and behavioural disorders. I click on that. I can look at a rate and the map will change. So this is basic navigation through themes. I can also look at individual suburbs. So let's say I'm interested in Armidale. And the map flies me straight to that. Let's go back to births, as that is kind of that's an easy one to demonstrate. Right. Here we go. So we'll go back to number of births, for example. and I'll explain some of the basic filters. So up the top here, we've already started playing with those themes here. They all open up. You can click on all those and it shows up what's underneath it. I can change the age and the sex filter. I can also change the year. So here, for example, the latest available for births, I'm pretty sure it's 2023. So we'll change this. And now you see up the top, we're looking at the data for 2023. And then this little icon with the map of Australia, this is where those statistical areas are. So again, the puzzle pieces. So the smallest puzzle pieces in SA2, see how little they are? The map looks straight away much more engaging than before. If you look at SA4, the bigger regions, you still see a lot of variation. But of course, this is a very big area, and we all understand that within that, there is a lot of variation between the individual smaller areas that are within an SA4 and within an SA3. So let's just jump in here. And I knew that Armidale is one of the areas that has the highest number of births. So you just look at this map and straight away you see with colours, okay, this is really orange, this is quite orange. I look at my number here, 458 births in Armidale in 2023. I have a time series that tells me that the number of births has pretty much exploded in Armidale from 348 to 458. Are the services there? Are the parenting services there? Are the maternal and child health services there? With such a strong increase, this brings a lot of service demand with it. I can see on the national distribution, Armidale, even nationally, is pretty up there. If you're interested, the area with the highest number, you can just do that along this range. You can hover over this and it has two areas here that opens up. Rockbank, Mount Cottrell, and Mickleham Euroki. If you didn't know where that was, you can click on it and the map will fly you there and you're in Melbourne. So that's like a little sort of fun thing to see how communities compare on an indicator across the country. Or you can go back to Wanneroo again. Wanneroo, sorry, we're looking at Armidale. Jump back to that. With the colours are arranged on a scale which goes from blue and green tones to orange and red. Whether an area has a blue or has a low score or a high score depends on what indicator we're looking at. So let's say we're looking at low birth weight. We want the percentage of babies born low birth weight to be really low. But when we look at immunisation, for example, we want those rates to be pretty high. So the colours in the map and their significance and what they actually mean changes on and depending on the indicator that we're considering and looking at. We have over 1,000 indicators in the map at this point, and 1,000 data sets, I should say. So you have here only number of births, and then you could sort of make your way through other indicators that are hiding behind all these. So I've spoken to Chris a couple of times now, and she sort of said to me, there are key priority areas for communities. So if you know you have your key priority areas, and for example, one is mental health, one is substance use, you would start by looking at the information that is available within the atlas and start mapping and start checking with your priority areas first, rather than sort of going to, oh, I don't really know where to start. We can also provide some guidance with the map. So if you wanted to book in with someone from our team, we're available to do a one-on-one with you to sort of help you find the right information in the atlas. So again, so you don't get too much information overwhelmed. We'll jump out of here and I'll go back to my slides. I'll just present them from here, so that might be a bit easier. And we'll talk a little bit about how communities can use this information. So there's a couple of general slides and then we'll sort of try and link it in a bit closer with the State Health Plan. So it's important to look at data information if we want to drive change, because data highlights the need for transformation and improvement. So we want to be driving change, so we need to understand the situation as it is now. It is really helpful to understand the situation as it's been developing. We just looked at number of births. We could look at any other indicator, hospital admissions. We can see how that's changed over the recent years. And then we look to the future to see where we want to be. I think the public health plan goes to 2030, so we would apply a forward lens of, say, 5 years. We want to understand situations, so a holistic view, so considering not only health data, but looking at material basics, looking at how safe people feel, looking at learning is really important to help us understand the situation from a contextual perspective and not just from one single topic. It helps us set those priorities so we can investigate and explore if the priorities that we've set are actually, does that sort of match what we see in the data? The priorities that we see as a community, for example, in regard to service use, is that really what we can see that's supported by the data, or do we perhaps have to adjust some of the priorities? And then we can track progress, so that if we know we have put an intervention in place, we can then look a couple of years down the line and start tracking our progress of hopefully improvement and evaluate the outcomes. I've already mentioned about this data mapping. So what we're doing with some communities is we sort of start mapping around each of the domains where they are at the moment. And then often communities would go and start a conversation with representatives around what can be observed on the ground, what is the sort of local knowledge and evidence, and how can all this be brought together to then have the community work together on bringing about this change. With data, what we have also heard from communities is that it really empowers communities. So what we've heard in the past is that representatives often feel they're not given all the data that they need. And again, Tim, I really loved how Tim sort of showed the plans that they've produced and the dashboard that's now available and the public health atlas. I think very often in the past, communities and community representatives just didn't have all the information that they needed. And yes, sometimes it might be a bit out of date, but we need to equip people with knowledge, and knowledge is then power, and that empowers communities to advocate for themselves and also to understand how they are faring comparatively to other communities, and whether that's neighbouring communities or communities in other parts of Australia. So it's really empowering for people to actually understand where their community stands and how they're faring compared to other regions. And this is particularly vital in communities that are facing higher levels of disadvantage, who just, really feel empowered by being able to say, look, this is the situation for us, and we're really advocating for change here. And data can be narrative. So you would have administrative data sets, such as the ones you can pull from our atlas, but there's also community experiences. The community has so much knowledge about what happens and goes on in their area and region. If you bring all these things together and then maybe coupled with also some individual surveys, you're building a really powerful picture. I will take you back to the atlas and show you an example of what happens in Katanning. This is a couple of years ago now, but in 2018, Katanning, when we looked at because I know what I'm looking for, I'll look at oral disease-related, zoom out for maximum effect so everybody can see. So this is the picture that was presented in 2018. That's when the first WA Atlas was launched. That Katanning was the area with the highest rate of oral disease-related admissions of 0 to 4-year-olds. So an entirely preventable condition, and yet babies, toddlers, were admitted to hospital for oral disease-related problems at a rate that was the highest in the state. The community, for the community, this wasn't new. They knew, let me just highlight this, the community knew that this was a problem. They actually had an even higher rate in 2008, but really not the means to advocate for additional services. There was no paediatric dentist in town. So education was one thing, but also there was actually no service for families to take their children to. So the community advocated it, and with the help of the Atlas, being able to sort of show it in this highly visual way, the situation that they were finding on the ground, they were then able to advocate for funding. They received about, I've got the little write up here, with support from the Early Years Partnership, Amity Health received close to 140,000, and they then delivered something that became called the Central Great Southern Dental Health Project. This sort of then developed into a bigger initiative, and now I'm pretty sure Katanning has a regular dental paediatric dentist who visits the town weekly or fortnightly on a Friday. So the service is now in town, and if you go back to the atlas and we change to, I think we have up to 2022, Katanning is now this little pattern here, so that means that the number is in fact so low that we can't calculate the rate because of low numbers, and so therefore you could say, you know, in very simple terms, the problem has gone away. Not saying that there aren't other issues, but for this particular problem, Katanning now does not have a problem with oral disease-related admissions. The problem has gone to other places, and you can use the atlas to see where interventions might be necessary now. But just to show that with this sort of resource and information, it was possible for the community to advocate for itself. How am I going for time, Chris? Am I okay to go another 5 minutes?
Absolutely. Yep.
Okay. So let's jump.
Can I just add in there, Marketa?
Sure.
That's a really brilliant case study and reminder for local governments, because I think often there's a tendency, particularly amongst your elected members as well, your councillors and others, to feel as though this public health planning process is blurring some of the boundaries and responsibilities between state, federal and local government areas. Dental services is clearly not the responsibility of local governments, but identifying these issues within your community that might be standing out as unique or unusual can provide you the evidence to support advocating and advocacy on a particular issue as an action you can include in your action plan for your local public health plan. I've been attending some zone meetings for WALGA recently, and this issue has come up, and we've discussed the value of including focused and targeted advocacy for increased services and partnerships as a great action that you could include in your public health plans. So I just encourage you not to sort of think of these examples as not within your remit, but just to think of it in a holistic way around, what's the role of my local government here? It might be about, policy, partnership and advocacy rather than service delivery.
Right. Yeah. So look, I have sort of spent a little bit of time looking at the priorities in the plan, and often in the next slide I've sort of highlighted the 4 sort of promote, prevent, protect, enable. And really what I will say that to bring the community along on this real journey of promoting, preventing, protecting, the community should understand what it is about, what health and wellbeing is, what the situation is for the community now, and what can be done to change this. So really equipping the people who live in that community with as much knowledge as possible. So it shouldn't be a secret around those things. People should just know. And yes, one community might be faring better than another one, but perhaps we are doing better on another indicator. And by having more and more conversations about strengths and perhaps gaps and areas of improvement, that will bring the community along. And having an atlas such as the Child and Youth Wellbeing Atlas allows people to go and have a look for themselves and to really bring the community along on this journey, rather than this knowledge and information being the privilege of a few who just seem to know something that the rest don't know. So really, if this is something that affects the whole community, so, you want to foster a strong and connected community, the community needs to be informed and understand what the environments are. So if you then And one note, actually, I need to make this note about Aboriginal health and wellbeing. So at the moment, we have only a few indicators that disaggregate the data by Aboriginal status. So look at outcomes for Aboriginal children and young people separately. The reason for that is not that we don't want to do this, but we are undertaking a bigger research piece at the moment, which is a large community consultation and also the development of an Indigenous data governance framework. It's quite a big word, but what that will ensure is that the Aboriginal community has an opportunity to work with this data and to determine how they would like the data to be included in a culturally respectful and safe way, rather than perpetuating what are largely deficit-based indicators about outcomes for Aboriginal children and young people, which we know are pretty much across the board much less favourable, and Aboriginal children and young people face much more disadvantage than all children and young people. So rather than replicating data that at the moment you could go and look at elsewhere, we just really want to find a way that does it in a culturally respectful way and that brings the community along. So this is something that's coming. It's a lens that we know is critically important, but we also don't want to rush this. So this is something that's in development and we're a year and a half into the process. I would guess another year before we have a clear idea of how we will disaggregate for Aboriginal children and young people. So let's look at some priority areas, as I've mentioned a couple of times. So it would be really important when you look at your priorities to establish what is the community already doing, what are we already doing and what are we doing well. And that's really great. So you sort of start off on a really positive note to say, we're doing this, we're doing really well. That is something to be proud of. And then to look at the gaps. And a resource such as the ASIWA can help you, identify those gaps, identify perhaps new priorities or revisit existing ones to identify if really they are the core priorities or if perhaps you need to there needs to be a bit of a shift. So let's say we're looking at youth mental health. So you would go into the atlas and just demonstrating again. We'll go into Wanneroo this time because Karen will speak a little bit more from a local perspective. We'll go into Wanneroo. And I'll make sure, just reminding everybody again of the filters. So we'll make sure we're in the smallest filter, which is SA2. We're looking at 2022 and we've got themes. So if I'm looking at mental health, I can type that into my search box. We'll start here. I could, for example, go into community mental health service contacts. And we'll pick something like community mental health service, the rate per 10,000. You could start with investigating. So you highlight Wanneroo. You can see that for 2022, for all age groups 0 to 24, the rate in Wanneroo was 1,566. You can then compare this to surrounding areas and, more importantly, to your time series. And you can see that there has been a significant up and down, but really the trend is going upwards in terms of community mental health service contacts. Going back to here, you could then start looking at ED presentations. Let's go into ED presentations, mental health attendance related for all hospitals. Again, Tim mentioned that this is one of the data sets, of course, that they're using and that the health department has. I should mention, so when you're looking at where the data has come from, can you see that little eye here? So you've got your indicator showing up in the left bottom corner. If you click on the eye, it shows you the data collection that the information has come from. So this has come from the emergency department data collection supplied through People WA. For those of you who are not familiar with People WA, it's a large linked data asset that WA has. It's overseen by the Department, Premier and Cabinet. And it brings together core data collections from across all the departments in WA. So there would be health data, education data, data from the Department for Communities, Justice, et cetera, et cetera. So that's where we access the data. We work with the data in a secure environment, and then we only export data at aggregated levels. So here you can, for example, look up ED presentations, mental health attendance related. We're looking at 5-year age groups. Good point to show you the little age slider. We could, for example, change this to 15 to 19-year-olds. We're still in 2022. You've got your theme here. It's always good to check so you know what you're looking at, making sure that you've got the result here. And again, you can go down into your time series. And again, there's been a marked increase from 9.8. We're looking at a rate, so we're not looking at numbers. It's important when you look at population, you want to be looking at a rate. The rate has gone up to 42. And then we can also look at presentations due to deliberate self-harm. Same thing, you can pick 5-year age groups, 15 to 19, and get your results here. Neighbouring Dutch is a significantly higher number than Wanneroo does. So this already helps you start building the situation around mental health and what some of the key data points are. Comparing this to a different topic such as learning, not sure people here are familiar with the Australian Early Development Census, abbreviated to AEDC. It's a collection, and I don't want to take away from Karen, it's a collection that is done every 3 years with children in their first year of full-time school. And we have all the results from this indicator here in the atlas as well. A very common indicator taken out of there is the number or percentage of children who are developmentally vulnerable on 2 or more domains. There are 5 domains in the index. So we're looking at year 2024 is our most recent collection. So then Wanneroo, so we'll see the result here. We see that the percentage of 5-year-olds, so that's how old children are when they do this survey or participate in this data collection. 12% of children are developmentally vulnerable on 2 or more domains. And you can see how that number has changed over the years. There's been a marked increase from 2021. So that means that the percentage of children who are developmentally vulnerable has in fact almost doubled since the last data collection in 2021. So you've got 1 point around health, you've got a point around learning and developmental vulnerability, and then you might want to look at material basics. We've got the CEPA index, which I'm sure everybody's very familiar with. I'll just quickly click on this one. So you get your CEPA index, but also other things such as all the different types of income support payments. I found an interesting one as I was scrolling before. I looked at the parenting payment for single parents, and in Wanneroo, that has had a very marked increase. Now, this has been the case for other areas as well. So that sort of then sparked my interest. Oh, okay, that's interesting. Is this the case in other areas as well? And how do other indicators compare to this? So, for example, the percentage of low-income households, or I could even look at something like how many single-parent households are actually in Wanneroo. So we have family composition here, 1-parent families. And then I can see that in Wanneroo, comparatively, a high percentage and number of single-parent families. And again, something that's significantly increased since the last census in 2016 to the most recent census in 2021. So what I'm trying to show here is not to just confuse you and overwhelm you with this information, but this is how you would start building your data map. So you would identify the priorities, be that material, be that learning related, education related, be that health, and you start building your data points to get a better understanding of where your community is at the moment, and then re-identify your priorities and set a plan going forward. I will hand over to Karen at this point, and perhaps we can do some joint Q&A at the end. Chris, did you want to jump in first? I will show the data snapshots that we're doing for communities, but I'll keep that to the end as a sort of quick takeaway when I just talk about Atlas 2.0 at the end. But I think that might be a good spot for Karen to come in.
That's wonderful. Thanks, Marketa. I was just going to say, as soon as you did that last piece on single parent households, my mind immediately went to the equity and inclusion overarching objective in the state public health plan. And that really, that data provides that broader context. So where you're getting perhaps above average, rates of children vulnerable, to not meeting some of those developmental measures, the more data you have around the demographics of your area, the more context you can provide to some of those risk factors around access, affordability, and to services and support. So I think that's really useful. Thank you.
Thank you. So I will jump in now. Thank you so much for the opportunity. I'd also like to take this opportunity to acknowledge the traditional owners on the land on which we're meeting today and pay my respects to elders past and present, and in particular to the Kulungas, the children as they are emerging. As mentioned, I am a childhood development planner and work within the community development team here at the City of Wanneroo. Now, I decided not to do a PowerPoint presentation, but I actually feel like maybe I should have done that now that I see there are 30 people staring at me, but I'll definitely do my best. It will only take a couple of minutes to get through my presentation. So I just wanted to share with you how the City of Wanneroo has been able to use the Atlas, and in particular the Australian Early Development Census results. And as Marketa mentioned, the AEDC, as we call it, is a snapshot of how children are faring as they enter their full-time schooling years. So the snapshot is collected by the teachers every 3 years across Australia, and it is the most amazing resource to show how our children are faring at that age. So when the AEDC results came through in 2012, they showed that the City of Wanneroo children were actually about 23.7% of them were identified as developmentally vulnerable on one or more domain. Now, obviously in 2012, we didn't have the Atlas, so you're all very lucky to have access to that now. So we were going to the AEDC website directly to get this information. And combined with those results and lots of community consultation with our community, there were some very high attendances in existing early years programs. But using that information and the 2012 results, it really motivated us to design a program which we ended up calling It's All About Play. We wanted something that all parents could attend, so all families could attend, not just those that we deemed to be vulnerable. So just very quickly, It's All About Play is a free program designed for parents to enjoy with their children aged 0 to 5 years. We say to parents as they enter the sessions, this is a time for you and your child to play. A time for you to pop your phone on silent, which we know is important, follow your child's lead and just enjoy the play. The sessions are based around the AEDC domains, which are physical health, social competence, emotional maturity, language and cognitive, and communication skills. Each week we focus on one of the domains, and it encourages parents to support their child's development through everyday moments. The sessions commenced in 2014 and they take place weekly during school terms in all of our libraries. We have 4 libraries across the City of Wanneroo. They run for 2 hours, but parents can come and go as they please and they don't need to book. We actually realised very quickly that we needed to get professionals attending these sessions. So we have built this up over the years to include visits, regular visits by child health nurses or pregnancy to parenthood provisional psychologists or Wansley early childhood professionals, whatever we feel is needed in the community at that time to support the families. We've even trained other local governments in the program, so actually thousands and thousands of families over the years have accessed It's All About Play. We've got some amazing good news stories, as you can imagine, how families have engaged with the program, from being able to access early intervention to making new friends and everything in between. We also, like many local governments, take absolute advantage of applying for grant funding to increase what we offer to our community. And this is definitely where the Atlas can support this. We're currently working with Wansley and other partners to deliver a tailored version of It's All About Play called It's All About You and Me across the city. And this wouldn't have been possible without funding and using the Atlas to apply for the funding. So It's All About You and Me sessions that are currently running are smaller versions of It's All About Play, and particularly dedicated to be partnered with other early childhood professionals. So Marketa spoke about how the Atlas can be used to inform all types of program planning or to advocate for services to come into the area, and that is absolutely how we've evolved It's All About Play, to make the absolute most of those sessions where parents are coming together. And it's a really valuable tool in the advocacy space, and we've definitely used the data to inform quite a few letters of support. The City also provides the backbone support for the Wanneroo and Surrounds Early Years Network, or the WASI network as we call it. And we've got over 380 professionals in the Wanneroo and surrounding suburbs engaged with this network. So this has really allowed us to be able to share the Atlas to our partners to ensure that it gets used to its fullest potential. And I often get on a bit of a high horse about the way that local governments can engage with early years networks. So it's been invaluable in getting that message out there. So if anyone is interested in having a chat about early years networks and how local government can support, please let me know. So I have been a part of the Atlas project since it began, and like anything, the more you use it, the better you will get at it. So if I can mention anything, it would be just to have a play around with it. I think if you can dedicate a little bit of time each week just to jump on the site, have a bit of a play, you'll be amazed at what you can achieve from it. And like me, hopefully become an advocate and start promoting it far and wide. So I'll leave it at that. I'm happy to answer any questions that might come from this chat or what you've heard, especially from Marketa with regards to the Atlas. But if there's anything, I can answer it now, or feel free to get in touch with me via email or phone. More than happy to have a conversation with you. Thank you.
Thanks so much, Karen. I'm surprised that the chat box isn't full of questions, because I've got so many. Is there anyone online that would like to ask a question of any of our speakers before I jump in? I wonder, Karen, I wonder if I could put you on the spot and just ask if you've reflected since we've met about how this work might translate onto the City of Wanneroo's public health planning process, and whether you've looked at, how you might work across those teams to sort of bring some of the value of the work you've done with the Atlas into that planning process.
Yeah, it's really highlighted what's available, I think, being part of this discussion. And I am part of the community development team. So I know we've got, within the City of Wanneroo, we've got other teams working on the public health plan. But I think it's highlighted how different teams can get together and talk about what's happening and just make the most of the resources that we've got available to us. So and even just hearing Tim speak earlier, there's so much amazing information out there. It's quite exciting to be on the journey, and definitely support people working together across teams within their local government to get the most out of it and to ensure that we're, giving our community all the right information.
Absolutely. And just to reiterate the message in our very first webinar series is that local governments are already doing work that's contributing to the well-being of their residents already. So go out and map that and pick it up and work out and work with your colleagues to think about, is it sufficient for now? Have you reached, the limits of your resourcing? Is this an opportunity to leverage for, a bit of a stretch or an ambition or a new way to extend that work through your public health plan? I think it would be safe to say that nearly all local government areas have some form of playgroup or parenting support, social network that brings parents together, particularly working perhaps with your child, and infant and child health nurse and other services at the state level. So, I'd encourage you to reach out and think through, even if it might be your librarian coordinating that project through story time. And I'm just drawing on my own experience as a parent here, not an expert in early years work, but I just encourage you to do that. There's a question here from Jessica.
Straight to the point.
What is the best way to pull the data? What an excellent question. What is the best way to pull the data off the atlas?
Yeah.
I would speed dial Marketa. That's what I would do. But great question, Jess.
Yes. So look, and there's two answers to that question. Firstly, at the moment, the best place is to go to the data dashboard. So when you open the AustralianChildAtlas.com page, rather than going to the maps, go to the data dashboard. The URL, as you will see, is our academic partners QUT. The dashboard still sits there. The functionality is very similar to how the maps work. So you select your state, the region, and then you select your topics. You recognise the filter buttons. It is a little bit clunky, though, I will say. So if you do struggle, Jessica, please, by all means, feel free to send me an email. This is changing. So next month, we are launching Asiva 2.0, and the data download facility will be integrated within the maps, so that once you are in a particular map view, and this is under construction, so just disregard the graphics of this, but see the page that I've just opened up, that's our test page. There'll be a data download feature down here where these buttons are, where you'll be able to download directly. Depending on the file size request, we will send you a link to a secure file, or if it's, not that big and you're not asking for too much, it'll be a direct response. So it'll depend on what size data you're requesting, but it'll be integrated in here. But for now, it's the data dashboard, as of next month, integrated. And otherwise, with any questions about functionality or how to use the platform, like I mentioned before, we're available for one-on-one sessions or to, a smaller group within your team, and happy to make this really tailored. If you, have a couple of key priorities and you just want one of our team to help you get the most out of the resource, we're available to go through that with you.
Fantastic. And we can also circulate to people here, but also perhaps Tim might, and I think Parvi Krishnan's online from Department of Health, we might be able to notify people when that 2.0 is launched, so that people can, because I've seen a demonstration of some of the features and it's very cool. I think you'll find it quite user-friendly, and some of the outputs from those downloads really useful, that you could use in your own presentations to council or to your executive and other things. So we will share that for sure. Patricia.
Very happy, Patricia. Please do. Not quite sure how to answer Guy's. Is this historical? How long it took us to build this? It is a fully custom built platform, so not Power BI or Esri. It's a fully custom built platform, so it took about 1.5 years for original development, and the last 2 years we've been building 2.0. But maybe I can just quickly show one really beautiful feature of the new platform will be data snapshots, where you can click on this. You can pick your area. It can be SA2, 3 or an LGA. You pick your state, you put in your suburb. Let's say I live in Kareen. And you can create a report pretty much like a dashboard that will take 1.5 seconds once it's live, and it populates some key indicators of children and young people's wellbeing. You can download this then in PDF and just put it into a slide deck, presentation, report, whatever it is, grant application. So that gives you a snapshot of, oh, you can't see the screen. Oh no, I've been going through all of this and you can't actually see what I'm doing. Sorry, here it is. You didn't see the steps for me to get there, but that's basically, you'll be able to pull a snapshot such as this for any region in Australia. So you pick statistical area 2, 3, or local government, you pick your state, and then the individual suburb, like I said, over 2,500 SA2s. You click on create report, and what you'll get is a snapshot of key indicators of children and young people's health and wellbeing in that particular region. It takes 1.5 seconds.
Was there an infographics feature to there, Marketa?
Sorry, say it again.
Could it generate some infographics as well? Was that part of the offering? Maybe
Aceva 3.0 will make this fully customizable so that you can pick your own indicators and how you want this to look. For now, there are some preset templates for each different geographic resolution.
I'm so pleased to see that other people are swooning on the chat, because I certainly did when I first saw that. That's fantastic. There is much support in the chat for this work. I
just say in closing, so because Patricia mentioned they might be reaching out to us. So for us, as I've mentioned, we're currently funded by Minderoo and Ian Potter Foundation. For us to be able to continue to exist into the future, we need to build a really strong case that this is a resource that is critically important. So we want users to come to us so that we know who is using the resource and that it is important and that it is being used to really change outcomes for children and young people. So for us, that's great. And very happy to collaborate with you to help you get the most out of this, which will then help us to be able to continue building this resource into the future.
That's fabulous. Thank you. I just wanted to do something a bit sneaky at the end, not sneaky, but just unscheduled, that I just wanted to give a plug for the WA Commissioner for Children and Young People. I'm not sure if people are aware that the Commissioner runs periodic surveys via schools around children and young people's wellbeing that provides more qualitative data. So where the child the atlas is giving you lots of numbers and figures and rates per population. This survey provides you with more of the narrative around how children are faring, particularly on some of those matters around feelings of belonging and inclusion. And so I've popped the link to that in the chat. I'm just going to see if I can share the website just because we've got a bit of time.
Actually, I might jump in here, Chris. We have some of the Speaking Up survey data from 2021 in here, but publicly available at this point is only the state level data. The Commissioner has published regional reports. So once you have that link there, people can go into that and see the regional report, so results on a regional level. I think if you scroll down, there should be a bit further down. So these are all the theme ones, topical, and then there is, I think, one for each education region. Under the region report should be. And so SOS 2025 is currently in the field. Some of you might have heard about this. They're in their last couple of weeks and there'll be new results early next year published. So that's super exciting. Oh, here, data by education region. I think that might be it.
Yep. So I've added the link into the chat so people can explore this. I just love it because it does have that regional comparative sort of aspect to it. Not all schools participate, so it's not a comprehensive capture in terms of every school participating, but it has got a strong element of cultural safety around it, with lots of work with Aboriginal children and young people, which is great, but also children with disability. So it's just providing a bit more of that contextual information, which would really, I think, be of interest to people on this webinar, and again could support you as you're shaping up your community engagement and consultation process, because I'm sure that many of you are alive to the very distinctive kind of needs and interests and priorities of within your community. So I just thought I'd point to that great resource as well. And just make sure. Okay. Just a reminder that we have got the recordings of our previous webinars on our website. If you Google WALGA Public Health, it'll take you straight to the page. Many of you will have visited there to register for the webinar. I'll just make sure that everyone's got that link in the chat. Last week we had a great presentation from Suzanne Butler from Injury Matters about the very diverse, broad services and supports that Injury Matters can provide. But one of those was around specific data on injury from, it covers a wide scope of injuries from falls through to road trauma and mental health related harm. So please don't forget to go back and look at that recording of last week's. Tim was pointing out as well around some of the fact sheets that the Department of Health has. Oh, no worries, Karen. Thank you for everything that you've done for us today.
Thank you.
The South Metro Health Service is delivering one of the first in a webinar series on climate change and the impact of climate change on health next week. So please make sure that you tune in to that around heat health and the work that local governments can do. I'm just going to share the link so that you can register for that if you haven't already. I think it's been enormously popular. I think they've got record numbers of registrations for that, which is fabulous. So that will really support you to attend to that new priority in the state public health plan around addressing the health impacts of climate change. And we will also be running a webinar next week. I hope that you're all enrolled already, but that's going to be looking at funding opportunities through Lottery West and Healthway, and also Cancer Council's resources that they have tailor-made for local governments to support them in their public health work. So please do tune in for that one. That will be looking at funding for the implementation of actions in your plan. So that'll be a really great session as well. Again, all of these will be recorded so you can go back and revisit them, speed through to the bit that you want to, go over again and remind yourself of how to do some of these amazing pieces of work and the supports that you need in this process. Okay, if there's no other questions. Oh, Marketa, yes, go ahead.
I'll do one more little plug then, as you're talking about and climate. And because it's not specific to children and young people alone, We've just added environmental indicators to the atlas. So not sure if that would be directly helpful, but just as an example, so under environment, we now have a section on climate, and that is obviously, it says age 0 to 24, but it's population based. We've got climate here, we've got heat, as was just mentioned. I'll change this, I think it goes up to 2020. And so maybe that is useful as well for people to see some of this information. It's all new to us. We've only just started looking at this average temperatures, extreme heat, excess heat factor. So if it's helpful, that information is there as well. There's about 25 indicators now under environment, climate, air quality, and adaptive capacity. That's it for me.
I think this overlaying of data across geospatial kind of areas, I can see and can tell from the organisations and researchers and other developers approaching WALGA is just a burgeoning kind of area. I think it's the hot spot to be, and it's where public policy and data and community are all coming together to intersect. We had a great meeting the other day with ECU researchers leading the Australian Food Atlas. I'm just going to put that in the chat as well. Their Frith is applying and expanding this work out at ECU, but that's another resource that will continue to grow over the next 12 months. And local governments are really vital to building this resource, because environmental health officers on this call will know that they're often the custodians of the most current information about food outlets, supermarkets, and hot food takeaway retailers. And it's really, the Food Atlas is another platform that's available to use. It's not necessarily fully populated at the moment, but I've just put the link in the chat so you can have a look. But it's looking at the proximity of so access to food, all different types of food, healthy food and junk food and other everything in between, but also proximities to schools, and other sort of community meeting places that will give you some insights into some planning, advocacy, forward planning for your local governments as well. So this is totally getting to information overload. I'll wrap it up there. You can go and play and in the chat and revisit the chat and look at all those different links for some inspiration. But I'd just like to finish by thanking very much Marketa Reeves and Tim Landrigan for your great presentations, and wish you all the best to those online with your public health planning.